While having PRP put into my thumb joints, the practitioner told me she gets a lot of calls from women wanting the O shot. And I get it. One day you wake up with a dry vag and intercourse is uncomfortable or maybe even painful. And this is a very helpless feeling, exasperated by an inability to talk about your vulva health to your doctor or to your partner. So if this is you, please check out videos I've made about vaginal dryness, vulva, and clitoral atrophy. So what do? You go online seeking solutions and stumble across the O shot, which on the surface seems to be an easy, one and done sexual solution to a very complicated problem. But is the O shot procedure what it claims to be? Hi, I'm Dr. Trina Read, sexologist. Thank you for supporting my YouTube channel. Your support helps grow women's sexual pleasure. And if you want to take your sex life from meh to magnificent, please check out my free masterclass workbook and videos. Let's talk about whether the O shot is a good fit for you. In this video, we'll discuss the efficacy of PRP and whether the O shot actually works. You'll then find out about women who love the O shot and women who do not. And at the end of this video, you will learn about an all-natural vulva health alternative if you decide the O shot is not a good fit for you. There is a long list of reasons why vulva and clitoral atrophy can occur, which include aging, hormonal changes, and medical problems. And this can all lead to difficulty with arousal and lubrication or even painful sex. Now, there are no FDA-approved treatments for women with sexual arousal difficulties like men have with Viagra. When I started to experience vulva and clitoral atrophy, it was disconcerting to say the least. So my first experience was with breastfeeding and perimenopause, which caused uncomfortable and sometimes painful intercourse. But they were blips, just every once in a while occurrences. But now that I've moved into menopause, things have shifted. And here's the important thing. It's been a gradual shift, and it would have snuck up on me if I wasn't paying attention. And therein lies the challenge. Vaginal dryness, vulva, and clitoral atrophy aren't a problem until they're a problem. And it seems to happen overnight when intercourse becomes uncomfortable or painful. And this is not easy for most women to talk about to her partner or to her doctor. So this can lead to a couple disconnecting, fighting, and worst case scenario, becoming roommates. The O shot is marketed as a pain-free, one-and-done procedure that helps women with a whole host of sexual difficulties, which we will get into. But first, let's discuss what PRP is. Platelet-Rich Plasma, or PRP, is a procedure in which the doctor draws blood from the patient and places it in a centrifuge. The centrifuge spins the blood to separate the platelets from the other blood components. Those platelets are concentrated in the plasma, which is then re-injected back into the body. Health Canada approved PRP, but it is yet to be FDA approved. So in Canada, PRP is regulated as a drug and must be performed by a medical practitioner. So I'm Canadian, and to get PRP treatment for my thumb joints, I needed a requisition from my doctor. And here's the part that you need to pay attention to. My doctor said he was fine writing up a requisition for PRP. It's a safe procedure using my own blood, but there was a chance that PRP would not work for me. Essentially, PRP was an expensive experiment to see if it would help my arthritic thumb joints. And for me, that was what was missing from the information found online about the O shot. That cautionary voice saying that the O shot may work for you, but then again, it may not work for you. As my grandma used to say to me, I'm going to tell you the facts and you do what you want with this information. Let's look at how the clinics are promoting the O shot. So their literature says vaginal PRP shot is a non-surgical treatment that stimulates both the clitoris and vagina with the growth of new cells to make the injected area more sensitive. Platelet-rich plasma supports collagen production and increased vascularization, which results in overall skin improvements. The first injection site is just to the side of the clitoris, and allegedly, the PRP spreads under the skin to have effects on the entire clitoral system. The second injection site is within the vagina, along the front side. PRP allegedly stimulates some of the glands that lubricate the vagina. Some clinical websites report that PRP also spreads to the G-spot, which they say is responsible for vaginal orgasms, which is not true, but that's for another video. The clinics go on to say the effects from the vaginal and clitoral PRP shot lasts between 12 and 18 months, but varies from patient to patient. Some clinics cite studies that show between 75 to 95% of women enjoy sexual function improvements soon after treatment. I tried to find these so-called studies and could not source them, so I'm pretty skeptical about their efficacy. I read through many clinic websites who promise pretty much the same thing, that the O shot's going to be pain-free and give immediate results. It will correct vaginal dryness, improve vaginal lubrication, increase ability to experience a G-spot orgasm, improve skin quality on the vulva, address stress urinary incontinence, correct weakness or pain in the pelvic area, that it will reverse chronic vaginal pain from childbirth or a transvaginal mesh, and it's going to relieve sexual dysfunction or painful intercourse. And you are going to get all of this for the low, low price of $1,800 US. But you know what they say, if something seems too good to be true, it probably is. A well-known marketing technique is to find a person's pain point and dig in. And I honestly don't know if these O-shot clinics are preying on a vulnerable population or offering women relief from a difficult and tricky situation. I think it's probably a little bit of both. I know if I was a woman experiencing vaginal difficulties, the thought of a one-and-done PRP procedure is absolutely intoxicating. But buyer beware, you are only getting one-sided information. And there are very few cautionary voices trying to give researched information on the O-shot, one being OBGYN and women's sexual health advocate, Dr. Jen Gunter. On her website, Dr. Gunter states the O-shot's hypothesis of regenerating the vaginal area involves a significant leap of faith, that the O-shot needs further study, yet is promoted as a legitimate therapy by doctors hoping to cash in on women's sexual difficulties. Dr. Gunter claims there are no studies suggesting the O-shot improves orgasm or sexual function. There was one study that had 15 women take part in testing the O-shot. Only 12 women completed the test, and of those 12 women, 7 reported a reduction of vaginal inflammation, meaning the results of the study had nothing to do with the treatment of orgasmic function and are, therefore, inconclusive. Dr. Gunter states that there is no animal or human data to suggest it is safe to inject into the vagina or into the clitoris. Finally, Dr. Gunter states that a leading group of OBGYNs say it is deceptive to suggest procedures like the O-shot are acceptable and routine surgical procedures. Yet, on the other side of this, clinics who do the O-shot post positive testimonials from women. And I am assuming that these clinics are giving real testimonials, meaning the O-shot must work for some women. Dr. Kimberly Wright, who runs the Wright Center Clinic, wrote in her blog, I have patients who say they can't stop thinking about sex. They want to have sex all the time, sometimes to the point that it can be a problem, like when they don't have access to their husband due to travel or maybe even not having a partner. They would constantly be turned on, so much so that simply driving over a speed bump would produce orgasms. But over and over again, I would hear that their libido is off the chart. Now, I have to believe what Dr. Wright is saying about her patient's experience is true. However, I am skeptical that this is 75 to 95% of her patients' experience. Obviously, these clinics are only going to give you the good reviews. So to give you perspective, here are 3 testimonials that you will not see on these clinics' websites. I found these on Dr. Jen Gunter's blog, The Troubling Backstory Behind the O-Shot, and I'll put that link in the description. Jackie A. wrote, I wish I saw this before I went through it. I haven't had any luck since I had it done. Even my incontinence is bad. I think it might even be worse. I still don't have orgasm, and I'm very frustrated that I spent a lot of money on this and it hasn't helped. Juliet wrote, as a 20-year-old that just got this done, I am filled with regret and sincerely want to know, does it wear off eventually? Does it get better? Because I so badly don't want to live like this forever. And finally, Linda B. wrote, the O-Shot did nothing for me except cause an issue. I'm seeing a urologist today to see if they can figure out now why I pee on myself after having the O-Shot. There has got to be a way to get this information out. I did plenty of research and could find nothing but positive things before getting the shot. Had I been able to see something like this, I would have not gone in the O-Shot direction. After getting all this information, where does that leave you? So if you are experiencing vulva or clitoral atrophy, uncomfortable or painful sex, please understand that you have many, many options. So please take a step back, take a deep breath, and logically assess what would work best for you. So is the O-Shot right for you? That's your call. Full disclosure, PRP helped with the arthritis in my thumb joints. So PRP works in my body and the O-Shot might work for me, but you and I are different people. I'm going to give you the same advice that my doctor gave to me. PRP is safe, but there is a chance that it's not going to work for you. Essentially, PRP is an $1,800 expensive experiment to see if it's going to help your vaginal and clitoral health. So please do your research, ask hard questions, and be skeptical about the answers. Remember, the O-Shot is not FDA approved and has no peer review research proving that it works. But maybe you'll be one of the lucky ones who get the O-Shot and have amazing results. But before you go down the O-Shot path, please check out a natural way to help your vaginal health. Gynecologist and scientist Dr. Renji Chang developed the NuEve product line. Dr. Chang has done rigorous testing and research, and the NuEve product line is safe and it's also effective. Yet, the NuEve product line is not a one and done like the O-Shot. So this is where you need to know yourself. The NuEve is a good fit for you if you are able to develop a vulva routine. The NuEve product line is straightforward and it's safe, but it's also about remembering to do it. If you have a face routine, then it's super easy to implement a vulva routine. And NuEve will probably give you similar results to the O-Shot and cost less money. So please go to the NuEve website, check out the research, and check out all the reviews from women who have used the NuEve product line. And if you decide to buy something, please use my affiliate code Trina and you will receive a 5% discount. The link will be in the description below. Thank you for making it to the end of this video. I'd love to hear your thoughts and comments if you've had the O-Shot and what your experience was, or your experience using natural products like NuEve. Remember to check out my free masterclass workbook and video. The links will be in the description. And thank you for liking and subscribing to my channel. Your support helps grow women's sexual pleasure.